You're listening to Puma Podcast.
There's a bunch of evidences that school closure has zero impact, even negative impact on the infection itself. The reason is that the students who do not go to the school after school closure, they actually indeed infect somewhere else at home and with their friends. The school closure has no impact or even negative impact in terms of COVID-19 infection from the beginning. And the disease burden for the young generation is low, and the learning loss for after school closure is huge. So school closure is always bad, and face mask is usually much better.
COVID-19 has also resulted in the longest school closures in recent history. These school closures led to significant learning loss, which hurt future economic prospects by potentially lowering permanent income. The closures also aggravated pre-existing learning poverty and widened learning gaps across the region.
Hi, I'm Ed Faraon, Puma Podcast, and you're listening to Teka Teka News. In this episode, we listen to ADB economists talk about non-pharmaceutical interventions, or NPIs, during the pandemic. We talk about the effectiveness of school closures and travel bans against their long-term economic consequences. It's been 4 years since the initial COVID-19 lockdowns, and what the data tells us is that pharmaceutical measures, particularly vaccines, prove to be more cost-effective. But while governments buy time with non-pharmaceutical interventions, what can we learn from our COVID-19 experiences? How can we make vaccine distribution more equitable when the next pandemic strikes?
This report highlights the lessons learned from the pandemic to inform preparedness and responses to health emergencies. It systematically examines the elements of health emergency preparedness, highlights data limitations that constrain countries' ability to rapidly evaluate and adapt their policies during a pandemic.
That was Dr. Arif Ramayandi of the Asian Development Bank, speaking in a webinar discussing a report he co-authored, which highlighted learnings from Asia's health emergency preparedness and response from the COVID-19 experience. One of the key findings of the report was that governments must balance trade-offs in implementing non-pharmaceutical interventions, or NPIs, such as lockdowns, school closures, and travel restrictions.
COVID-19 has also resulted in the longest school closures in recent history. These school closures led to significant learning loss, which hurt future economic prospects by potentially lowering permanent income. The closures also aggravated pre-existing learning poverty and widened learning gaps across the region. GDP has also dropped well below trend in 2020 and has not recovered back even by end of 2023.
According to a separate report released in January 2024 by the Second Congressional Commission on Education, or EDCOM-2, the global average of school closures during the COVID-19 pandemic lasted 79 days, but Philippine schools remained closed for over a year. ADB warns that the long-term impact of prolonged school closures during the COVID-19 pandemic could widen income inequality. This is especially felt for poorer children who had to deal with unequal mitigation measures during the pandemic, resulting in gaps in learning levels. This is exactly why the ADB stresses that
the pandemic needs to rely on flexibility, innovations, and collaborations to deal with. These aspects requires an adequately funded healthcare system, well-equipped infrastructure, and motivated and skilled personnel. Successful implementation of pandemic response programs in the past was attributed to broad partnerships, close coordination, flexibility, and risk-taking ability.
part of this flexibility is taking into account the cost-effectiveness of certain measures during the course of a pandemic. When assessing the cost-effectiveness of interventions, it's important for policymakers to consider not only the direct benefits, such as reduced infection rates, but also the economic, social, and psychological costs. Professor Yunchol Bryant Kim, Associate Professor at Hong Kong University of Science and Technology, also spoke at the webinar on evaluating the impact of non pharmaceutical interventions, or NPIs.
Some NPIs are more effective before, or another one is more effective in the second half. Face mask, social distancing, quarantine isolation, school closure, travel restriction, lockdown, and contact tracing. Like these are the typical examples of NPIs. Like in the beginning of the pandemic, all of these are like these work because disease burden is super high. So it's totally understandable to introduce these very strong MPIs in the beginning. But after that, we realized that what is more effective, what is not more effective. What is always effective was a face mask. Like the psychological cost and the actual cost of the intervention is minimal, smaller than other things, but and the impact is large. And another one is the extreme case is always not effective with school closure. Like there's a bunch of evidences that school closure has zero impact, even negative impact on the infection itself. The reason is that the students who do not go to the school after school closure, they actually indeed infect somewhere else at home and with their friends. So school closure has no impact or even negative impact in terms of COVID-19 infection from the beginning. And the disease burden for the young generation is low, and the learning loss for after school closure is huge. So school closure is always bad, and face mask is usually much better.
We're pausing for a quick break. When we return, let's hear how an international pandemic agreement can make vaccine distribution more equitable. Before the break, panelists discussed evaluating non pharmaceutical interventions, or NPIs, for a more cost effective pandemic response. The report also showed that pharmaceutical interventions, particularly vaccines, were consistently more cost effective than NPIs. But if we've learned from the COVID-19 experience, we have to recognize the problem of vaccine inequity, especially for poorer nations.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries.
That was World Health Organization Director General Tedros Adhanom Ghebreyesus back in 2021, calling out the quote, "me first" approach some countries and manufacturers were undertaking, while vaccines were just starting to roll out.
44 bilateral deals were signed last year, and at least 12 have already been signed this year. Not only does this me first approach leave the world's poorest and most vulnerable people at risk, it's also self-defeating. Ultimately, these actions will only prolong the pandemic, prolong our pain, the restrictions needed to contain it, and human and economic suffering.
This is why Dr. Gina Saman, who currently serves as the unit head of the Pandemic Preparedness Global Platforms at the WHO, underscored the need for an international pandemic agreement.
It's a very busy couple of years. Why? Countries are negotiating an instrument. They're negotiating and working together to say, how do we set the policies for making it more equitable? So an intergovernmental negotiating body is considering a WHO convention, an agreement, or another form of instrument that can address these issues. And this is critical. Working together, recognizing the inequity is a critical global step to reduce the distance between the haves and have-nots.
But the WHO worries world leaders won't reach the May 2024 deadline to conclude negotiations for the pandemic accord.
At the political level, world leaders at the UN General Assembly high-level meeting agreed a strong political declaration, including a commitment to include negotiations on the pandemic agreement and amendments to the international health regulations by May this year. But I must say, I'm concerned that member states may not meet that commitment. Time is very short, and there are several outstanding issues that remain to be resolved. In my view, A failure to deliver the pandemic agreement and the IHR amendments will be a missed
That's
opportunity.
international health regulations.
IHR amendments will be a missed opportunity for which future generations may not forgive us. It will take courage and it will take compromise from our side. You will not reach consensus if everyone remains entrenched in their positions. Everyone will have to give something or no one will get anything. I urge all member states to work with urgency and purpose to reach consensus on a strong agreement that will help to protect our children and grandchildren from future pandemics.
And that was today's episode of Teka Teka News. I'm Ed Faraon. This episode was edited by Pidoy Blanco. Our Teka Teka News executive producer is Jill Caro, and our senior news editor is Veronica Uy. If you found this episode interesting or useful, share it with a friend. Thanks for listening.